JG is a 30-year-old female with systemic lupus. Her story starts in February of 2019 when she was diagnosed with autoimmune hepatitis and placed on azathioprine and tacrolimus. She developed scarring lesions in her ears, significant lymphadenopathy, and proteinuria. She underwent renal biopsy, which showed class 5 or membranous glomerulonephritis. She was diagnosed with systemic lupus with lupus nephritis at that time. Given these new symptoms despite the use of azathioprine, she was placed on mycophenolate, tacrolimus, and hydroxychloroquine. She continued to develop more enlarged lymph nodes, so belimumab was added to her regimen. This improved her symptoms minimally. Her blood work revealed ongoing lupus activity with persistent proteinuria. She was then switched from belimumab to rituximab infusions in addition to mycophenolate, which helped somewhat, although her fatigue, enlarged lymph nodes, and discoid lesions never completely resolved. When her proteinuria persisted, we decided to screen her and enroll her in a CAR T therapy trial. She's now about 120 days from her CAR T infusion. Here you can see her lupus manifestations prior to CAR T therapy. On the left, you can see her discoid lesions in the ear canals and on her scalp. On the bottom, you can see her diffuse alopecia on the crown of her head. And in the middle here, you can see a representation of the lymphadenopathy she had in her cervical region. On the right, you'll see her labs of pre-CAR T therapy. She had a high titer ANA of 1 to 1280 speckled and very high titer anti-Smith antibodies. Her UPC ranged from 0.4 to 1.1. Here you can see her manifestations after CAR T therapy. She had much less fatigue to the point where she was able to be taken off of disability. Her discoid lesions completely resolved in her ears and on her scalp. And she had no more alopecia with new hair growth. On the right, you can see her labs post-CAR T therapy. Her ANA had decreased to 1 to 320 speckled, and her anti-Smith antibodies were negative. Her UPC has been stable, less than 0.15.